Hi, Dr. McCarthy here, and I want to welcome you to our little Facebook Live chat on Thursday evenings. Tonight, we're going to be speaking about the nightmares that people are dealing with thyroid issues and fibromyalgia issues. And I'm a chiropractor. I've been in practice for 23 years, and I'll tell you, I've seen for 23 years people come into my office with thyroid problems and fibromyalgia issues. And 23 years ago, people like that scared me because I didn't know what the heck to do with them. Issue is, we weren't taught in school what to do with patients like that. So it wasn't until I met a good buddy of mine and a mentor, Dr. Michael Johnson. He wrote this book, What Do You Do When the Medications Don't Work? A Non-Drug Treatment of Dizziness, Fibromyalgia, Migraine Headaches, and Other Chronic Conditions. And the other chronic conditions are things like fibromyalgia, thyroid, Hashimoto's. And so I actually learned from Mike that there's a bunch of things that can be done to help these people that are all natural. No drugs, no surgery. And it's about changing people's lifestyle, changing people's diets, doing chiropractic work. I still do chiropractic work on everybody. But there's a huge piece of the puzzle that we always do. It's called oxygen therapy, exercise with oxygen therapy. This is a book written by a colleague of mine, Dr. Donatello, and I'm a contributing author to this book, Energize Your Brain, Change Your Life, An Introduction to Exercise with Oxygen Therapy. In order for your nerves, your brain, and all the nerves in your body to function properly, they need two things. They need fuel and they need activation. And the fuel comes from the food that you're eating and the air that you're breathing. And we found that many people who are dealing with chronic health problems aren't getting good oxygen supply. And if you have anemia, the inability of your red blood cells to carry that oxygen where it needs to go, like into your brain or into your feet, it makes the problem even worse. So I'm going to go over a whole bunch of things with you tonight. I'm going to fill this board up with information, but I'm going to show you the 6 things that I consider to be the keys to fixing people who are dealing with thyroid issues and fibromyalgia. And again, I'm not curing any kind of disease. That's not the game that we play here. We're about making you healthy again. If we can make you healthy, then you don't have these issues anymore. We share our information now in the form of DVDs. We've produced a whole bunch of DVDs, but I just want to highlight a couple of them for you here. This first one that we did was Breakthrough Treatments for Chronic Health Problems, the Management of Chronic Neurological and Metabolic Conditions. And this kind of sets the stage for how we treat people here, and I'll explain it to you. We treat people neurologically, meaning working with the nervous system, and we treat people metabolically. That means working with your body chemistry, changing the way that the inside of your body functions. And when we can do the two of those things together, that's what enables people with fibromyalgia and thyroid problems to get their life back. You gotta be able to tackle both problems at the same time. As far as thyroid is concerned, we produce this DVD, Breakthrough Treatments for Hypothyroid and Hashimoto's Disease. On this DVD, we go into very specific detail about thyroid function and all the things that need to be done. The big issue that we see is that thyroid is one of the most poorly managed conditions in healthcare these days. The big issue is the proper testing is not done. And if you don't do the proper testing, you're never going to get a proper answer as to what's going on. The crisis that we face in healthcare today is that we don't really have healthcare in our country here. We are about 5% of the world's population, and we take about 60% of the world's drugs. So if drugs make you healthy, we should be the healthiest country in the world. And not only are we not the healthiest country in the world, but we're moving in the wrong direction. Somewhere around 1950, we were ranked 5th in the world, and in 2010, we're ranked 50th in the world. So we're taking more drugs, spending more money, and our health is going down. While there's, small countries that don't spend anywhere near as much money on healthcare as we do, take the drugs that we do, and they're moving past us. They're getting healthier, we're getting sicker. It's because the system is broken. We just try and give people more and more and more drugs. And that doesn't make people healthy, it just makes people druggies. And we're here to break that system. There's not a week that goes by, there's not a day that goes by in my office where I don't have a patient say to me, there's a man who's in here today. He's, through our dietary measures, he's lost about 25, 30 pounds. As such, he's had to cut his blood pressure medication down 75%. And he told me when he first came in, the blood pressure was never going to change because he's always had blood pressure issues from the time he was a teenager, and now he's like 60 years old, 70 years old maybe. That's not going to change. He's just going to have to take his medicine. I said, you just watch. That's all I can tell you. And his blood pressure was getting so low at the same dose of medication that he was taking that he had to go to his doctor and lower the dosage. He's down to 25%, and now he thinks he's going to be able to get off of it with his doctor's help. I don't get people off of drugs. I get people healthy so that they can go to their doctor and get off of drugs. Cholesterol medications, lots of the selective serotonin reuptake inhibitors. If you can fix people's underlying problems, and I'll explain them to you here tonight, then you're able to help people get off of medication. One of the big things that we deal with is blood sugar regulation. Traditional healthcare says, oh, you got a blood sugar problem, here, take the pills, take the shots. I say, you got a blood sugar problem, change what you're putting in your mouth. And if you change what you're putting in your mouth, you won't need the pills and the shots. And we have lots of people that come in here already taking metformin, glucophage, doing insulin injections, and after a couple of weeks, couple of months, their blood sugar has come down so much they got to stop. They have to stop taking the medication, otherwise they wind up hypoglycemic. One of the things that we see very frequently here in the office is fibromyalgia. People that have been diagnosed with fibromyalgia, and we'll talk about that some more. But in this DVD, we talk about breakthrough treatments for fibromyalgia. Things that we do here in this office that's unique, that nobody else in this part of the country is doing. And if we can do these things and you can follow directions, it's going to work for you too. And then lastly, another one that I've very much enjoyed helping people with, breakthrough treatments for peripheral neuropathy. This is the most recent DVD that we've produced, and we've got a couple more coming down the road. But again, like thyroid issues, peripheral neuropathy is one of the most poorly managed conditions that we see. Burning, numbness, tingling in your hands and your feet. And you go to the doctor with these symptoms and they say, fine, you're going to take Lyrica, you're going to take gabapentin, you're going to take Neurontin. They just give you a drug. And so I'll invariably, we see people here in the office and I say, okay, you've been taking that for 6 months. Has it helped? No. Well, then why do you keep taking it? You know, what they don't tell you is that in 2009 there was a study done that shows that those drugs, which realistically, in actuality, they were only approved by the FDA to treat epilepsy. So what they're doing is they're they're preventing the new connection between nerves inside your brain. So you take these drugs and it stops your brain from creating new connections. And we think that that's going to make somebody healthy? So, you know, I could understand if you took the pills and it made you feel better and you didn't know what was going on in your brain because either your doctor doesn't know or your doctor knows and didn't tell you. I don't know what it is. But if it's not even making you feel better, why would you keep taking it? This is what gets my goat. This is why I get up at 5 o'clock every morning. I'm up at 5 every morning and I'm studying. I'm studying new neurology and metabolic protocols. And I'm studying things to make me a better me so I can help you become a better you. I mean, that's the bottom line. This is what I wake up for. I've got a purpose. And 5 o'clock in the morning rolls around and it's like, let's go. Let's study. And if your doctor was getting up at 5 o'clock in the morning to learn new things, you probably wouldn't be dealing with the chronic health crisis that you have. Now, you know, granted, I'm not picking on medical doctors. Some of my best buddies are medical doctors. However, it's the system. It's the system that they're in. It's broken. It's like you've got to see 40 people a day, you got to write the prescription, and you got to get out of the room. We don't have time for anything else. Move, move, move. I have a buddy of mine that got out of the system because he wasn't happy with that, and I pat him on the back. I think the world of him. He's a fantastic guy. He wanted to take the time to spend with patients and teaching and educating about exercise and diet. There's no time for that in the modern system. It's a sad state of affairs. Our office is very different, though. Plus, we're not writing prescriptions for drugs, so we're not doing the same damage. What we're going to put in the middle here is you. And I'm going to show you the overlaps between the two, people dealing with thyroid issues and fibromyalgia. Whenever I do a thyroid or fibromyalgia workshop, it's always together. There are many, many similarities between the two of them. And you can see, you know, when we put this up on Facebook, all the list of symptoms, and many people are like, oh, I have that, and that. They told me I have fibromyalgia. And another person says, oh, I have that, and that. They told me I got a thyroid problem. So it's very similar. So we'll explain this to you in greater detail. But I'm going to show you all the things that go into what makes you, you. the 6 things that you need to know. And if you learn these 6 things, and this is what we do here in our office. You know, I am here to help give you information. But if you get this information, you don't take any action on it, what good is that going to be? Where are you going to be a month from now, 3 months from now? Are you going to be any better? Are you going to be healthier? Is your life going to be changed if you haven't done any of this stuff? Here in our office, we do it with people, all right? I don't do things to people. We do it with people. My patients work together, and I hold people accountable. I'm going to tell you this is what you have to eat, and if you're not going to follow directions, don't do anything here in my office. You got to show up for your appointments. You have to do your oxygen therapy. You got to take a couple of vitamins, whatever it is, whatever your labs show us that you need. So, you know, you got to do this together. The first thing that we do is we do a neurological evaluation unlike anything you've ever seen before. We practice what's called brain-based therapy. It's functional neurology. It's like neurology that actually does things to you, does things for you, not a pill to cover up your symptoms. We do a neurological evaluation to find out what's going on inside your nervous system. We study the top of the brain to the bottom of your feet. And we look at comparing the right and the left, and the front and the back, and the top and the bottom. We compare your brain stem, left and right, top and bottom. And we look at all your peripheral nerves. And when we see issues between right and left or top and bottom, that's a red flag. And that lets us know, okay, that's something that needs to be taken care of. Then we prescribe specific targeted neurological therapies, things that we do here in the office. We give people a lot of homework to do as well to reinforce the things that we're doing here. Simple exercises. One of my favorite things to do is we utilize eye exercises because the eyes fire very powerfully into your brain. And if we can use your eyes to exercise your brain, we have people do things at home. It's that simple. You got to know exactly what to do there, though. But what's tied in with the brain is your gut. There's a direct connection between your brain and your gut. When something goes wrong in your brain, it's got a negative impact on gut function. When something goes wrong in your gut, it's got a negative impact on brain function. So that's the downside to it. You know, if you got a problem in one area, it's going to lead to a problem in another area. The upside to that is, in our office, we treat both of these things at the same time, neurologically and metabolically. So as we're doing things to fix your gut, it's helping me to fix your brain. As we're doing things to fix your brain, it's helping me to fix your gut. And then we've been utilizing for the past year or so a new treatment, an electrical stimulation to affect the nerves that travel in between your gut and your brain. So it's really wild what we do, and it's painless. You feel like a gentle tingling sensation. And if you can utilize this and it works well for you, that helps us to fix your gut and your brain at the same time. And we have people take these machines home with them and they utilize them on a daily basis, 15 minutes, 30 minutes, every day. This has been helping people with anxiety, people with depression, people with irritable bowel syndrome, people with neurological disorders, a whole host of things. This is way cool. The importance of the gut, though, is due to the fact that that's where 80% of your immune system lives. And that's the latest number that I've seen. Some sources say 60%, 70%. Doesn't matter to me the number. The point is, if there's something wrong in your gut, it leads to something wrong inside your immune system. And the issue is, when I was a kid, I didn't know anybody that had autoimmune disease. Nowadays, we all know people with autoimmune diseases. If you don't have one yourself, you know somebody who does. Your next door neighbor, a family member, a friend. It is prevalent. Some of the more common things that we see are autoimmune thyroid conditions. It's called Hashimoto's, like on the DVD, Hashimoto's. Lupus, scleroderma, rheumatoid arthritis, psoriatic arthritis, all of these kinds of situations where your immune system starts to attack you. And when that happens, you start to get these terrible symptoms, whatever, depending upon what area in your body is being attacked. And so they give you drugs to just completely squash your immune system. And that's insanity. What you need to do is figure out what caused your immune system to go wonky in the first place. That's what we do. So again, see, I'm not trying to treat autoimmune diseases. We're trying to remove triggers that flare up your immune system. Many times, they're found in your gut because that's where the home of your immune system is. The very first thing that we deal with here are food sensitivities. There are dozens of food sensitivities. And, well, I'll just tell you, the number one food sensitivity that we see here in the office is gluten. And it's just ugly. It's horrible. However, you can go to your traditional healthcare provider and get a test, and it's not this gold standard state-of-the-art test. They'll run the wrong test and they'll say, hey, you don't have a problem with gluten, you go on ahead and eat anything you want. So you have to know what you're doing. And let me tell you this, and I'm not bragging here, but I was the very first certified gluten coach in the state of North Carolina. I've been studying gluten for a long period of time. I know exactly what the testing should be, I know exactly how to interpret the results, and I know exactly how to fix people that have a gluten sensitivity. If you don't do it the right way, you're going to mess people up. All right, so I'm not bragging, I'm just telling you, I've been doing it for a long time. But gluten is just one out of like 28 different foods that we normally test for. So if you've got a gluten sensitivity and you're sensitive to 5 other foods and you stop eating gluten for 2 weeks, but you're still eating those 5 other foods and you don't feel any better, you're going to say, well, I guess gluten's not a big deal. I stopped it for 2 weeks and I still felt crummy. So you got to know what you're doing, okay? Food sensitivity, that's huge. That leads to what's called leaky gut syndrome. If you keep eating foods that are creating an immune system reaction, it creates a leaky gut syndrome, where basically the little tiny microscopic holes that are supposed to allow small digested proteins and nutrients and minerals through your digestive tract, your small intestine, large intestine, to get into your circulatory system. Those little tiny holes now become large gaping holes, and now large undigested proteins can get into your circulatory system, where your immune system finds them and says, what the heck is that? Kill it, make antibodies, destroy it. That's where something like a gluten sensitivity comes from. Not to mention the fact that gluten is one of the more commonly modified foods, genetically modified, cross-hybridized, whatever you want to call it. It's not the same. Let's just take wheat for an example. Wheat, rye, barley. This is where gluten hangs out. This is where it's coming from naturally. Those things have all been changed. So the wheat that we eat is not the same wheat as we were eating 50 years ago. The content of gluten in there has gone through the roof. But if you look at all these foods that are common food sensitivities, corn, rice, soy, they're all very different. And I'm not going to get into the ethical part of this, but I'll tell you, if you eat food that's really bad for you and it's destroying your immune system, you're never going to get well. It's got to be fixed. All right, next we talk about dysbiosis. Dysbiosis just basically means that you have too many bad bugs, bacteria living inside your gut, and you don't have enough of the good guys. It's a change in your biome, a dysbiosis. Normally there's supposed to be billions and billions of good bacteria and very few of the bad guys. But when those numbers get out of whack, that's when you develop what's called dysbiosis. Really irritating to your immune system. And the last piece of the puzzle, and we see this more frequently year after year, is actually a parasite infection. Very common to see in someone's digestive tract. And years ago, we thought it was like, well, that would be something that you would see if someone took a trip overseas to some poor third world country, or you went swimming in the Amazon River or whatever. You can pick up parasites right here in eastern North Carolina, and it's nasty, it's vicious, and if you've got digestive issues and you've never been tested properly for the presence of a parasite, I don't know what to tell you. Call my office. We'll do the proper testing. So a couple of things that we need to do to fix your immune system is we find out what foods you're sensitive to, get rid of them. We heal the leaky gut. We kill the bad guys living inside of you and repopulate your gut with good guys through taking probiotics and using fermented foods. And we also kill parasites. But we do this using all natural protocols. Herbal formulas, for the most part, will help to kill the bad guys. And then a probiotic helps to repopulate with good guys, and the fermented foods helps to feed the good guys. Some other things that need to be evaluated in order to get your immune system functioning optimally is vitamin D, Vitamin D levels, you need to get 2 levels checked. 25-hydroxy and 125-dihydroxy. If you've only had 1 level of vitamin D checked, it's wrong. It's wrong. You gotta call my office and I'll tell you exactly what needs to be done. Essential fatty acids, that's omega-3, fish oil, EPA, DHA. You need to be making sure you're getting a ton of this in your diet, and if not, you can use a supplement, but you gotta find a good quality supplement. Patient brought one in today. I'm not gonna mention the name of it, but it was a fish oil supplement, and it contained rice and corn and soy, which basically means it had a whole bunch of artificial stuff in it, genetically modified artificial stuff. And I said, you know what, that's just really, it's not going to cut it. I'm sorry that you spent the money to buy this, but not only will it not help you, but it could create a lot of problems, specifically with your immune system, because if you've got a sensitivity to those foods, that's bad news. Glutathione, last piece of the puzzle. Glutathione is a very powerful, your liver produces nice amounts of glutathione as an antioxidant when you're healthy. The issue is when people develop chronic health problems, your liver is kind of in survival mode and doesn't have the raw materials or the time to produce lots of glutathione. So you're losing out on the antioxidant properties, and you start to get what's called oxidation. Your body starts to produce free radicals that can't be put out. It leads to more inflammation. So if we want to fix your immune system, we've got to deal with these things. We've got to get your vitamin D levels up, both of them. Improve your essential fatty acid, just your fatty acid intake, and glutathione. Glutathione production, glutathione recycler, or we sometimes use glutathione cream. All right, so number 1 is your brain. Number 2 is your gut. A lot of stuff going on there with your gut. All right. Number 3, blood sugar. We want to see everyone's blood sugar, your fasting, your morning fasting glucose, come in at 85 to 99. And right now, you're probably chuckling if you got a blood sugar issue. I haven't seen 99 in forever. Well, if you get above 99, it creates insulin resistance. And if it goes up even higher than that, that's when they'll give you that diagnosis of diabetes and you start taking the insulin shots, which creates more insulin resistance. You gotta change your diet. I show you how to do that. If it goes down below 85, that creates hypoglycemia. So you got to make sure you stay right in this area here. And this is what your blood sugar should look like throughout the day. And the average person that walks into my office dealing with a chronic health problem has blood sugar that looks like this throughout the day. So they're alternating between insulin resistance and hypoglycemia, and insulin resistance and hypoglycemia. Remember I said to you when we first started that your nervous system, the nerves, need fuel and activation. And the fuel comes from the air that you're breathing and the food that you're eating, the glucose, your blood sugar, right? Specifically your brain. Your brain only weighs about 4 or 5 pounds, but your brain sucks up about 1/3 of your blood sugar. So it needs constant, steady supply of blood sugar all day, every day. Even when you're sleeping, your brain is using glucose. You need to make sure you've got good supplies of glucose. If you are insulin resistant, when your blood sugar is too high, the glucose can't get into your brain. It's resistant to the insulin. When your blood sugar is too low, there's just not enough glucose to get to your brain. So if this is how you're living your life, do you think your brain's going to be happy with that? Absolutely not. The good news is God gave us a way to deal with that, and that's called our adrenal glands. And the adrenals are our stress glands. They sit on top of your kidneys. The adrenals kick out a chemical, a hormone, called cortisol. And cortisol works to get your blood sugar back up when it's not functioning properly. And that's fine. You know, that's the way it was intended. However, this cortisol release to balance your blood sugar was supposed to happen under times of extreme stress, not 4 or 5 times a day because you're not eating the right way. And when that happens, your adrenal glands start to get fatigued. That's a big issue. So The cortisol will have a couple of downside effects too if it keeps getting pumped out, pumped out, pumped out. Cortisol starts to affect an area in your brain that deals with memory. So you see the blood sugar issue causes cortisol to fry a part of your brain that deals with memory. So much so that many researchers are calling Alzheimer's, the cognitive decline, type 3 diabetes. The blood sugar has directly led to a decline in your memory through cortisol. Let me repeat that. Your blood sugar regulation is critical to proper brain function. We see people that come in here all the time. My memory, names and numbers, I can't find my car, I lose my keys all the time. I got brain fog. Thyroid problems, fibromyalgia problems, peripheral neuropathy problems, brain fog. Everyone's talking about brain fog. This is it. This is it. But again, there's no pill to fix that. You have to change what you're eating so you get your blood sugar back here, 85 to 99. I show my patients exactly how to do that. Exactly. All right, next is what comes along with cortisol is epinephrine and norepinephrine. And when these guys get released, they irritate your free nerve endings. What that means is it makes you hurt all over the place. I'm just achy. Everywhere you touch me, I hurt. Does that sound like anybody you know? Fibromyalgia, perhaps? Absolutely. So blood sugar plays a key role in that. Oh, one other thing, cortisol. Here's another big issue. Cortisol will make you gain weight, and specifically gain weight right here in your midsection, gain visceral fat. And the visceral fat is the one that's directly linked to inflammation, cancer, heart disease. Inflammation drives every chronic disease known to man. So the diet that we put people on, we call it an anti-inflammatory diet. You got to change the foods, but you got to get your adrenal glands to stop being so stressed out. These guys don't get released. This doesn't get released. And all of a sudden, people start losing weight. They lose weight right here. And we don't put people on any kind of weight loss diet per se. We put them on an anti-inflammatory diet. And as you start to get healthy and your brain stops screaming at your adrenal glands and you stop releasing cortisol, this is where your body just starts to burn the fat. It's wonderful. Wonderful. If you just stay in this situation where you're eating your Mac Whoppers and your ice creams and your sweet teas, and the brain keeps screaming at the adrenals, keeps kicking out cortisol as long as it can until you start to develop what's called stage 7 adrenal fatigue. And along the way there, you start to develop a new symptom. I got sleep issues. I can't fall asleep, or I can't stay asleep, or some people have both. I can't even imagine that. I get to sleep at night, my head hits the pillow, and 5 minutes later I'm out. 5 o'clock in the morning, I'm up, and that's just like, let's go. That's the way it works. Everybody coming into my office has some type of sleep issue where it's at least one or the other. Can't fall asleep, can't stay asleep. That's a surefire sign of the adrenals fatigue. It doesn't mean you just need Ambien, right? If you go to your doctor and you say, look, I'm not sleeping, they don't take the time to draw this picture on the board. I hope they understand this physiology, but they don't take the time to address it. They say, Ambien, take your Ambien. Ambien's a hallucinogen. We can't just keep taking, go around here, let's take an antibiotic, right? Let's take some synthetic vitamin D, some synthetic fish oil, eat whatever you want, take an Ambien. You got headaches, take an Imitrex. And do we think that that's making anyone healthy? This is crazy. This is why, with only 5% of the world's population, we take 60% of the world's drugs. This is why. And it's a flawed system. Okay? So, what do we got here? We got brain, gut, immune system, blood sugar, adrenals, last piece of the puzzle, thyroid. All right. Now, many people will come in and they'll say, oh, my doctor, I did my yearly physical. My doctor did a thyroid panel. And a panel means a whole host of tests. My doctor did a thyroid panel, and he told me everything was fine. And then they bring their lab work in, or I get it sent over from the doctor's office, and I'll look at it, and all the doctor ran is TSH, thyroid stimulating hormone. Well, that's not a panel. That's one test. And to be completely accurate, that's not even a thyroid hormone, right? Your TSH comes from your pituitary gland in your brain. Remember I told you, the brain is the master system of your body. The brain is the master organ in your body. The brain controls and coordinates the function of every cell in your body. The brain tells your thyroid what to do. And as your thyroid starts creating its hormones, the brain is always sensing, how many hormones do we got? Do we need more? Do we need less? And it just tells your thyroid through TSH, give me a little more, slow it down. Give me a little more, slow it down according to what you need. That's if you're healthy. That's if you have a normal feedback loop. All right? So you actually start here with the hypothalamus, produces thyroid releasing hormone, and then the pituitary produces TSH, and the thyroid kicks out two hormones, T4 and T3. And T4 is actually an inactive form. It needs to go somewhere inside your body and get converted into T3 in order for it to have some kind of metabolic effect. All right? So it produces a whole lot of this, not too much of that. So you need to convert T4 into T3, so you've got get up and go. And this is one of the more common problems we see, is that people are having issues converting T4 into T3. So if we just ran a TSH test and that came back in the normal range, but you couldn't convert your T4 into T3, well, your doctor doesn't know that because they didn't run the test, but the TSH was in the normal range, they say, no, there's nothing wrong with your thyroid, everything's fine. When in fact, that's one of the more common problems we see. And if that's the case, you can't convert your T4 into T3, you got no energy, you got no get up and go, you're gaining weight, your females will start losing their hair. I mean, it's a scary situation. But what is most commonly overlooked is that the number one reason that people's thyroids go down, and you start to get those hypothyroid symptoms, sleep issues, tired all the time, gain weight easily, constipation, brain fog. The number one reason people have that is because the immune system is actually attacking the thyroid gland. That's Hashimoto's. We see this very commonly associated with a gluten sensitivity. Many gluten sensitive people wind up having an immune system that attacks your thyroid. And so, your doctor doesn't know this stuff or doesn't take the time to tell you this stuff because all they're going to give you is synthetic thyroid hormone anyhow, which doesn't make any sense. You need to get the testing done to see if your immune system is attacking your thyroid. We run the antibody test here in our office. And if your antibodies come back elevated, then I can confidently look at you in the eye and I say to you, you don't even have a thyroid problem. Your problem is your immune system. So these things need to be fixed. But when you go to your doctor, they say, eventually, they'll say, oh yeah, it looks like, thyroid is sluggish because your TSH is too high, according to them. TSH got too high, you got a thyroid problem. Here's your answer. Synthetic thyroid hormone, right? So what they give you is synthetic T4. But what if you got a problem converting it into T3? We see this all the time. Patient came in today. She got Synthroid about a year ago, and I said, okay, good. Did you feel any better? She said, well, for about a week I felt a little bit better, but for the past 51 weeks, I feel exactly the same way. I'm tired. I'm gaining weight. I'm trying to watch what I'm eating, and I'm gaining weight. My memory, my brain fog, she was at her wit's end. So she's taking this medication, it's not even doing anything for her. So that's a surefire sign to me that she's got a conversion problem, but I'm going to run the tests. And when I run the test, I'll be able to say, look, your T4 is in the normal range, your T3 is in the toilet. You can't convert. So then, we have compounds that we can use, again, herbal, nutritional substances that can help with the conversion. So, but if this is the issue, and we're going to run antibody tests on her, if that's the issue, she doesn't need Synthroid. She needs to have her immune system fixed. So, that's the 6 things that I wanted to cover with you tonight. If you have any questions on any of this stuff, I want you to just ask it below. I'm going to sign off now, and then I'll check back later when this is up on my page. But you can ask questions down below and I'll answer them. And quite frequently it runs into days and days of people asking questions. That's great. I love it. I love sharing this information. Feel free to share this video with someone you know and love. I've got a network of doctors that we work with all across the country. So if you got a friend or somebody, an old college buddy who lives in Sheboygan, Wisconsin or whatever, I'll find somebody for them out there, okay? This is really critically important. I hope you understand it, and I will look forward to talking with you, answering your questions, and feel free to call my office if you have any information, you want to set up time for a consultation. The number is down below. It's 252-758-2222. Thank you.